Okay, Tessa, earlier you told me you had some pain. Can you rate your pain for me on a scale of 1 to 10, or 0 to 10? 10 being the absolute worst, 0 being no pain at all.
6.
Okay, just wait 1 second. The doctor's order he has here, for pain rated between 5 and 10, we are going to be giving you Demerol today. Demerol is a 2 milliliter injection. So 3 places I can give you Demerol is in the deltoid. I would find that by bringing my pinky to the acromial process, bringing my 3 fingers down, lining my thumb up with the axillary line, and in this triangle I could give that. I can also give this in the ventral gluteal area. So the way I would find that is I would put my palm on the greater trochanter. I would point my pointer finger towards the anterior superior iliac spine and my middle finger towards the iliac crest. And in that triangle there is where I'd give the medication. That is where we're going to give the medication today. We can also give it in the vastus lateralis. And to find that, I'd put my palm on the greater trochanter and on the lateral condyle of the femur. Inside this rectangle, we would divide this rectangle into 3 and give it in the middle thirds there. We are going to give it in the ventral gluteal area though. Okay, so I'm going to start by making sure that I have my drug, Demerol. And that is what I want, is Demerol. I'm going to clean off the top of my vial for 30 seconds. 1, 2, 3, 30. And then I'm going to also clean the area that I'm going to be giving the injection. So like I said, I would put my palm on the greater trochanter, pointer finger towards the anterior superior iliac spine, and middle finger towards the iliac crest. In here is where I would rub in circular motions for 30 seconds. 1, 2, 3, 30. I'm going to leave that there just to mark where I'm going to be placing that. So for this drug, I'm going to be using a 22 gauge 1.5 inch needle. We want this to be a intermuscular injection, so that's why we're using a bit of a longer needle. I'm not going to be using the needle just yet though, so I am going to remove the needle from the syringe, and I am going to open up my blunt tip and put my blunt tip on. Okay. We're going to be administering 2 milliliters. So I bring this down to 2, taking the cap off, and then place this in the vial, expelling all the air. Then I bring the vial upside down and I bring out 2 milliliters of the drug. I double check with the MAR that it is Demerol, 2 milliliters, 2 milliliters. I'm going to do that again. Demerol, 2 milliliters, Demerol, 2 milliliters. Easton, can you verify that this is correct?
Yep.
Okay, thank you very much. I'm going to check one more time. Demerol, 2 milliliters, Demerol, 2 milliliters. The 5 rights of drug administration are right dose, right route, right patient, right time, and right drug. A little bit about Demerol is it's needed for pain. It's a narcotic. It alters pain perception and reaction through the nervous system. A common side effect is drowsiness and fatigue. A serious side effect is shallow breathing and slowed respirations. An assessment we would do is assess the breathing. We did that to Tessa already. She has 16 respirations. She is more than okay to take this drug. 12 to 20 is a normal range for respirations. And we do not need any labs because this is a PRN medication. I would then remove the vial, recapping it. This is not a dirty needle, so I can recap this blunt. Okay. I would then remove the blunt and reinstate the needle. Okay. I'm going to remove the cap for the needle. And I'm going to be using the Z-Track method today. So the way we do this is we pull down on the skin, making sure that it is nice and firm. We then insert the needle into the muscle. We want to aspirate I'm going to hold the needle with my 2 fingers while holding the skin firm. I'm going to aspirate just a little bit just to make sure there's no blood, and there is no blood coming up when I aspirate that. I'm now going to administer the drug at 10 seconds per milliliter. So there's 2 milliliters and it'll be 20 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, I'm gonna leave the needle in for 10 seconds just to ensure the medication is in. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I am then gonna remove the needle and put the safety on. I'm gonna open my gauze. Letting go of this, I'm going to apply pressure for 10 seconds to the injection site. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. And then I'm going to dispose of the needle into the sharps container along with the blunt I would dispose of. I would then let the patient know, Tessa, this is going to take about 15 to 20 minutes to kick in. Is that okay?
Mm-hmm.
Okay. I would come over and I would document my findings. This drug hadn't been given for the last 24 hours. So I'm going to give the time that the drug was given and my initials just so the next nurse knows this can't be given for the next 4 hours. Tessa, is there anything else I can do for you today? I have time.
Mm-hmm.
Okay. And then I would document my findings.